Good afternoon, everybody. Today is September 24th, 2021. My name's Scott McGann with the Falmouth Health Department. And each Friday I do a COVID-19 update for you. The email for health for any questions is health@falmouthma.gov. Our phone number is 508-495-7485. And you can visit our website. There's a COVID tab on there. Put a lot of this information, including this presentation, on there. So if you want to go back to it, you can either, I think it's on YouTube as well, but you'll go to FCTV, and then it's also on the town's website. So we've had a better week this week. If you watch me every week, last week we were at 70, 71, somewhere in there. So we're at 1,914 cases since the beginning, 32 this week. Again, that's better than half of what we had the previous week, so that's great. We'll definitely take it. 4 probable cases, rapid antigen tests, not school-based. Those were not the ones that were based on school. We'll talk a little bit that after. We do want you, if you have a child in school, to get a PCR. So those should show and be reflected as PCR tests. So you want to validate the rapid test. And if you are also doing the home kit, the home kit's not going to make it. You should verify with a PCR so that we can get proper contact tracing. Okay. Our incidence and percent positivity is provided. This is provided by the state, so we're not having my number and this number, so it's pulled at the same time. This data is from the 5th to the 18th. It's the 2 previous full weeks. Falmouth was 30 last week for the 2 weeks. We're 26.3, and if we just did this week, we're down to 14.25 because we've had a better week. But 14-day daily incidence rate per 100,000 means if Falmouth had a population of 100,000, there'd be 26 cases, per week, per that time frame of 2 weeks. So since Falmouth's about a third of that would equate to 6 plus cases, per, depending on basically 1/3 of that. So that's a daily incidence rate if the population was 100,000. Is 26.3. That doesn't mean Falmouth's getting 26.3 because we're about a third of that population. Our positivity dropped about 0.4-ish, 0.45, from 4.92 to 4.57. Again, that takes into account the 2 really lousy weeks we had previously. So that number, both of these will be driven down by this past week, which is good, and hopefully an indicator of what's to come for us. So you can see in the chart, the far right indicates each weekly case count. You can see we had 3 weeks where we were 50s, 60s, or low 70s. We've dropped to 32. Let's hope it's a trend. Obviously, we don't know, but that's where we are with our weekly case count. This one here is the flatter and more densely compact those dots are, that's better we're doing. When they're spread apart and going vertically rapidly, that's when it shows that we are having some spread. So you can look at that sort of right after the holidays, and then again, we had one in the spring with a blow up in the mid-Cape, and then we had ours in the last 3 weeks. You can see them spread out and going up higher. Hopefully, we get a few more weeks and we can flatten that curve, so to speak. This is where that thing, flatten the curve, comes from. You want to flatten the curve with the daily cumulative case number. Countywide, you can see that it's been a little bit better in the county. The far right indicates the more recent. These are 3-day averages. You can see that over the last week or two, the numbers have been better. And again, hopefully it continues. As far as hospitalizations go, there were 7 in the hospital at Falmouth Hospital as of the 21st, 11 at Cape Cod Hospital. We were 6 last week. We were 3 and 3. We're 6 and 1. Better than not have them in the ICU. So even though it's a 1 net, I'll take the 1 less ICU beds. So we're not at a surge or anything of that nature. We've been relatively in that sort of 6 or 7 or less now. Even with the increases in cases. So, the hospital, as far as I'm, would know, is there's not an issue in terms of surge that you might be seeing in the news in other localities, especially those that have a lower vaccination rate. In terms of the state, this is the state's dashboard. Comes out it used to come out every day. Now it comes out Monday through Friday, and then Mondays is the big number where it comes out with the whole weekend's numbers. You can see 1,885. Last week was 2,000. The positivity staying relatively the same. We're doing a lot of tests. 109 is similar to what we were doing in 2020, 109,000 new COVID tests. So it's relatively, it's been somewhat flat over the last week or two in terms of that. Now, the deaths are up. In this report in particular, again, there was a delay. So as the numbers went up, there's usually a delay into deaths, but unfortunately there was 23 for this particular time for snapshot in time. If you look at trends, you can see in the right, you see testing in green. You can see where that's sort of been flat, which is good. You can also see that cases, you can see a downward trend towards an average daily case. Hospitalizations, again, it seems to be relatively flat, and then deaths, again, we're highly vaccinated in this state compared to our peers. This number hasn't jumped up. It's been remaining sort of on the low, relatively on a stable. And I'll talk about deaths among vaccinated people and hospitalizations among that in a future slide that the state provides. Again, getting back to positivity and incidence rates, normally we're in the middle ground, so to speak. This week, we were the highest of our Cape Towns. Again, this is pulling the data that we had a real lousy week last week with 71-ish, and the week before that was in the 60s. This is where that number is really going to show, and it's at 26.3, which is higher than the state and higher than our peers. And so that is on a downward trend. It was 30 the previous week. Every town was. There was a couple of towns, Barnstable, I think it was 31. So everybody's worked their way down. Ours is working its way down, but is higher for that time frame than any other Cape Town. Same holds true, second highest with percent positivity. Again, downward trend, which is great. We're not we didn't have an upward trend this week. We went 50, 60, 70. We weren't 80, 90, or 100 this week, which is great. And hopefully we can continue this slide, get our percent positivity and our incidence rate down. In terms of vaccinations, there was a 1% increase. So in Barnstable County, it's 73% of all residents are a percentage of individuals fully vaccinated in Barnstable County. In terms of our vaccinations, we did. There was 161 doses administered during the time frame. The data is of the 21st. You can see that the gains were in the 20 to 50 and also in the 12 to 15. Was where most of our gains were. Again, if you're considering getting vaccinated, you haven't been vaccinated, this would be a great time to do it. As boosters come, it increases those that can get vaccinated, and so therefore the demand goes up. Okay, I'll have a slide on that in a second. Getting back to fully vaccinated individuals, this is from the state. This comes out once a week. It's 32,345 breakthrough cases. 1,001 of those were hospitalized, which is 3%. And the deaths among cases is right around 6 to 7 per 1,000 of those that get COVID. So those numbers are definitely lower than what you would see among those that are unvaccinated. I don't think that's arguable based on looking at these numbers. Getting back to the vaccine, I need to reverse those slides because I'm going bouncing back and forth. Vaccines, again, vaxfinder.mass.gov is your friend. Okay. The pharmacies right now, Barnstable County Health Office, Convenient MD did have some, Community Health Center, special patient, homebound, call the health department if there's a homebound situation. We'll work with the VNA to do a homebound visit. In terms of testing, there's that school-based test and stay, wanting a PCR confirmation if it comes out positive. Bear with the schools. It's DESE is the Department of Early and Secondary Education. They've set the rules at which we follow. The school department has added staff to be able to handle it. It is quite a bit of work for them. There is some confusion among, I know parents. If you're one that's been frustrated, I understand. Everything, everything's being worked through. Everybody's doing the best we can with it. It is a little bit different, testing an unvaccinated close contact at school for 5 days. Doing all the paperwork required, it's a bear, and And we also, to think about it, is we started school at a higher incidence of the disease than we would have liked of. So we started warm, in that moderate category, and I'll show you that slide in a minute. So we started warm, therefore more cases are going to show up in school from outside infections just because we merely had more cases. So again, you're trying to figure out the best way to administer this test and stay program. At the same time, you're starting with more cases than hopefully we have, for the rest of the school season, or at least, for the foreseeable future. So the test and stay program, if you have questions, you should contact the school department. You can contact the health department. My nurse that we've been using through the pandemic is working with both. I've been having her over at the schools to work with the schools, so you can call us. We'll get back to you or answer your questions right then and there, and also the school. For the rest of those that is not school-based, you still have Convenient MD, which has been a heavy hitter with this, in CVS as well. Falmouth Hospital, through your physician, they'll have an appointment available. The fairgrounds currently, Sunday through Thursday from 4 to 6. I'd like to get that enhanced, but at this point, that's where we're at. And the Community Health Center also does testing. Okay, so that's where you can get tests. I know Convenient MD does both PCR and rapid. Falmouth Hospital and Fairgrounds is PCR, so that's where we are with testing. I'd like to get the Fairgrounds to have some more time. I'm working on the county and maybe increasing that time frame for the Fairgrounds. Because when you want a PCR, you want a PCR. You don't want a PCR at 4 to 6 on Sunday through Thursday. If you want it at Monday at 4 o'clock because you need one, you need to go to like the Convenient MD or the CVSs or through your physician or Community Health Center. So that's where we are with testing. Vaccine info, third doses. So right now, people with moderate to severe immune compromise can get an additional dose. The CDC recently recommended 65 and older. Residents in long-term care settings, people between 50 and 64 with underlying conditions should also receive a booster. Those that are immune compromised should talk to their healthcare provider. How the local health departments are going to get it and how it's going to actually go once it gets outside the pharmacies and we start doing it. Still, we don't, the state's asked us, we've done surveys and told them what we can do, and we're ready to do it once they start to involve us with that kind of, with this stuff. You can also go on COVID-19 vaccine at mass.gov, okay? Another thing about vaccines, FDA, Pfizer, for those, Pfizer's just had good results with their testing for those 5 to 12. Just reading, I heard maybe by the end of October, those between 5 and 12. We've done school-based clinics. We did some May, June. We did one in August, and we're doing one today. I don't think there's a lot of takers right now, but when the 5 to 12, we would be doing the same thing. We've done, I think, 3 school-based vaccine clinics, and as it opens up to other age groups, we'll also be doing it there as well. So I did have that question asked of me today. So as that sort of comes together, and we'll be able to act on that. Again, now, so what I did today is, I was a little confused. CDC has this on their website. What happens if you try to register? So what I did is I went on VaxFind to put in my zip code, and his CVS, for example. So if you click on, I need it, if you're starting your vaccination, no problem. If you need your second dose, no problem. That takes you right to the registration. But if you need to schedule an extra dose, and it says weakened immune system only because that's what the state has for us right now. If you click on that, it's going to get into the, what is your immune system, what is your weakened immune system, what's your condition. It's not going to necessarily automatically do it. If I went on, what happened is I clicked on that through Walgreens. I just gave information I wasn't. It says patients not immunized, who are not immune compromised, aren't recommended to get an additional dose at this time. So it's really still geared to the third doses, only those with weakened immune systems, and it's listed on the CDC's website. You can click on it through, just put in CDC guidelines for third doses, it'll come right up. It needs, it's really right now, they are getting into the 65 and older, that's what's on their website, but you're not gonna be necessarily able to do it at this time, at least going through here. I also went on, I think this is the Osco Shaw's, they're saying that you need not, if you did not get a J&J, because J&J is still pending, what they're gonna do for that is a primary series. So if you had Pfizer or Moderna, you need to also be up here with the immune compromised. Then you can proceed to booking if you're both. Okay? So right now, it's really still immune compromised, even though you're hearing things on the news that it may open up, but we're not at that point where the state, through the state's booking, through the pharmacies and whatever, the way to book through VaxFinder, has there been, your ability, if you're just 65 and perfectly healthy, and great, glad you are, able to get that third dose at this point. Face coverings and other mitigations. Again, this slide's a little bit old, but I'll keep using it. May 25th, we put a mask advisory when the state's guidance all disappeared. The state wants you to wear a mask if you're unvaccinated, vaccinated with a weakened immune system, and for public transportation. And the town advises that you should still wear masks indoors. CDC talks about going into fully vaccinated. Obviously, they say unvaccinated people should wear masks indoors, but vaccinated should also wear masks in areas of substantial high transmission. We'll talk about that in the next slide. And DESE at the state required the school to start the school year with masks. So let's look at our metrics. Again, the line in the sand is between moderate and substantial. We're down from 30.0 to 26.3, so minus 3.7, we're down. So we're still in the low for positivity and the moderate for incidence. We have not crossed the line in the sand, okay, which is between moderate and substantial. Our hospitalizations are higher than they were in July or some in August, but they're still in that sort of 6 or 7 range, 5, 6, 7. So that isn't, we're not at a point where our hospitals are at a point of, the breaking point like you're seeing again in the news. Our vaccination rates are high. So we're still at a line in the sand where additional mitigations like a full mask mandate, this is a topic at every Board of Health meeting. We meet every 2 weeks. If the board decides that they would like that, then they can always put that in. But at this point in time, what we're using is in areas of substantial or high, as the CDC has stated, and we're not at substantial or high at this point in time. And hopefully our trends continue where we don't need to consider that. So that's where we are with this. Again, as a recap, case counts jumped over the last 3 weeks, decreased significantly this week. Hopefully it's a trend. There is an ebb and flow to this. Sometimes Falmouth's high and sometimes another town, and it seems to ebb and flow. There is some long-term care cases, so sometimes that makes cases jump, but by and large, we've had a better week. We'll take it 1 week at a time, 1 day at a time. Again, vaccine eligibility is everyone over 12. Eventually, you might see, for Pfizer anyway, 5 to 12. If you've got somebody between 5 and 12 in age, a child, or a caregiver of someone that age, keep an eye on the news and keep an eye on my updates. And as that, if that comes down, sometime in October, we'll be doing school-based clinics, and it'll be opened up at the pharmacies and so forth at the VaxFinders, and there'll be opportunity to get it. So the town this week received 161 vaccines, which is actually down over the 200 plus that we've been doing over the past few weeks. Uptake is, slight, unfortunately. But, I think that's going to happen when we're over 80% vaccinated. So Falmouth residents, again, Cape's done really well with it. Third doses are still only for immune compromised. Even though the CDC, I pulled that 65 and older right from the CDC. This really, as you register, it's still immune compromised as far as I can tell. Even though they're starting to recommend that, the actual, getting to do that is still off a little bit, still a little ways, don't know when. Vaccine breakthrough does occur, but again, showing that previous slide that it's highly effective in preventing you from either hospitalizations or death. The vaccine is doing its job, though there are breakthrough cases. And again, the test and stay program is new for the schools, all schools it's new for. They're working through it. DESE set the guidance, and then it's sort of a moving target. I think as information and complaints or school administrators start bumping it, talking to DESE and say, well, what about this, the guidance, the FAQ, that keeps sort of changing, and I guess they're just sort of fine-tuning. It just happens to be with Falmouth. We started with a lot of cases in town, so we had to do a lot of work in the last couple of weeks, but getting the groove, and DESE will fine-tune it hopefully, and it'll work as time progresses. So that's what I have for an update. Good week, we'll take it. Hopefully it's just a trend to continue downward, and again, I'll do this update every week, and I'll see everybody next week. Thanks.